Integrated care is when a person receiving care from a number of different agencies receives it seamlessly. So from a patient perspective, it's a joined up service rather than individual agencies having to be called.
There are 4 coordinators, 2 in North Walsham, 2 in Fakenham. We all come from different backgrounds. There are 2 from health backgrounds and 2 from social care backgrounds.
The CCG has been working for some time with other agencies for integrated care. The other agencies involved are Norfolk County Council and also the Community Provider Trust that's responsible for, particularly for community nursing and the voluntary sector increasingly.
Working in between social services and health, I've got access to the social services database and the health database, and I'm able to build up a picture of the patient. I'm able to see what services are already in place.
From a health perspective, as a GP, I would be involved in patients' health care, the nurses involved, community nurses for example, but also very importantly for patients receiving care, social services have been involved, and they've been traditionally seen as completely separate from healthcare. And this is one of the things with integration, that we're trying to integrate these services from a patient perspective. Common sense tells us that if we do integrate care and it's provided seamlessly, that we avoid some of the duplication that's been there previously. So not only should we provide a better service for patients, but also it may well produce some savings as well.
A typical day for me would be an MDT meeting, which is multidisciplinary team meeting at a GP surgery. Our role is to facilitate the meeting with all the other health and social care people.
The GPs will generate a list of patients that have got long-term conditions or high needs.
And we would all sit around the table and discuss at-risk patients.
I will then go back to the office and put in place if somebody needs a social work assessment or if they need an OT to go out, and I will add the referrals or make phone calls to get the services in place. From the health services, there's the district nurses, the community nurses, community matrons, physios, OTs. From the social work assessment, we can arrange care packages, respite care, day care.
If a patient needs equipment in the home because they're falling a lot, then we can get somebody in to assess them and decide what sort of equipment they need.
The point of the services is to meet their needs and prevent a crisis and prevent hospital admission. The fact that the integrated care coordinators have access to so many voluntary services as well, that is invaluable.
When patients don't know, who to go to, often they'll call for emergency services, for example, and they'll end up in hospital when actually that's not the right place for them. When it's integrated, it means that they either they know who to go to provide care, particularly in the community, or they've already got that in place.
Patients will ring me back and say, I'm so glad that you were the in-between person, because that's what we get called, the in-between person.
Well, I think it's going to be increasingly important to move ahead with integrated care. And I think it's going to be essential in the next 2 or 3 years that we do that.